So the question is what is the comparative effectiveness, probably also getting at comparative toxicity of the different immune checkpoint inhibitors. And so the three main immune checkpoint inhibitors that have been investigated to date in non-small cell lung cancer are CTLA-4 inhibitors, as well as PD-1 inhibitors and PD-L1 inhibitors. I think that in general the data with CTLA-4 inhibitors has not been as robust, at least as a single agent, meaning that just giving that drug has not been as effective as giving a PD-1 inhibitor. And the upfront toxicities of CTLA-4 inhibitors have been somewhat significant. The toxicity profile for those drugs are fairly well known, at least in melanoma, as ipilimumab or Yervoy is an approved drug in the setting of melanoma. There has been more activity as a single agent, more activity in this time I'm saying activity in terms of research activity. There's been more efforts in the PD-1 and PD-L1 activity. I think in terms of comparative efficacy between the agents and comparative toxicity, I would just advise people to be very cautious about the data that is coming out. There is, I would say, sort of marketing campaigns essentially going on about drugs that aren't even approved to date. And so you can see the different language seeping into presentations sort of across the board of people who have a PD-L1 inhibitor versus a PD-1 inhibitor. What I would say is that scientifically we know that the best way to evaluate drugs, one against the other, is not to take, for instance, single agent experiences and compare them one to the other. It's not to try and identify who had a single event of a single toxicity. And so I think that it is probably going to be a very long time until we have any meaningful understanding about the differences, for instance, between different PD-1 inhibitors or PD-1 inhibitors versus PD-L1 inhibitors.